So,
James, we may have just been on mute for the whole time, so
oh my goodness.
we'll find out if we actually missed out. If anybody does notice that, please let us know.
All right. Well, here's what we're talking about today, my friends. We're talking about athletes getting back to their game with PRP. And so, here's the story. You guys remember Kobe Bryant. Think about him back when he was doing fantastic, and then he started to have some knee issues. He started to have a lot of knee problems. He actually was about to think about having a season-ending surgery. You know, once you have a surgery, it doesn't always go the way you want it to. So he ended up flying to Germany and getting his own blood taken out and then put back into his knees so he could recover. And well, do we remember how his career turned out? It turned out pretty well. All right, so this type of magical treatment that's once reserved only for the best of the best pro athletes, well, it's a little bit more common now. It's a little more common so that the common people like us can actually start to receive this. And it's not just Kobe Bryant who's received this. Other major athletes have done this to help themselves out and to recover from injuries. Peyton Manning, Tracy McGrady, heck, even Pope John Paul II received this so that he can move better and feel better with his knees. So that's what we're going to be talking about today. So, Dr. Danish, what exactly is PRP?
So PRP stands for platelet-rich plasma, and it's helpful to understand how the body heals from injury to understand what is PRP. In your body, you've got blood vessels that course everywhere, and anytime there's some kind of an injury, there's going to be some bleeding even on a microvascular level. Like, so the tiniest blood vessels in your body will break open and start bleeding. A good example of that is just think about the last time you scraped your knee. There's a lot of blood that comes out, and it's not because there's a deep damage to the body. It's just because you literally have blood vessels everywhere in the body. And so when you have that bleeding, there's a whole bunch of different things that are taking place. One is that there's red blood cells that normally carry oxygen that just flood into the area because they're the most prominent cell line in your bloodstream. Along with those blood cells are going to be, red blood cells are going to be the white blood cells or immune cells, and platelets, which are your clotting cells, the cells that adhere to each other and form this meshwork that stops the bleeding. Well, in the initial phase, the platelets' role is primarily to stop the bleeding, but as things stabilize and as the bleeding stops, the body then utilizes those platelets as signals to help recruit other cells into the area that do the repair. The problem with just whole blood is you get a lot of cells that are not really helpful. So the red blood cells that are there, their main purpose is just to carry oxygen throughout the body. They don't have any value in that tissue damage, tissue repair process. So they're just clutter, and the body has to clear the clutter before it can start doing the repair. Once the red blood cells are gone, now those platelets are going to be really helpful in stimulating activity that ends up bridging the blood vessels back to normal, bridging the tissue and healing that, giving your body the incentive it needs to start doing the repair. What we do with platelet-rich plasma is we take the whole blood, but we take out all the debris, the growth factors, the red blood cells that we don't need. In some cases, we don't even need the white blood cells. And in other cases, certain tissues respond better when you have the immune cells with them or not. But the point is that we want the platelets. The platelet-rich plasma is body fluid that's concentrated in the amount of platelets that it carries so that we have a super concentrated growth factor that we put into the area of damage and implement some repair process.
Well, that's some interesting stuff. Now, I've read that there's different types of PRP for different types of areas, and maybe that's why there's such a confusion about what exactly PRP is. What do you think?
Yeah, and I'll be frank, there's a lot of bad players in this field because it's a field that is in the infant stages. It's been around, the processes and the thought behind it has been around since the 1930s, but it's really gotten picked up more recently, and there's a lot of people diving into it because if you run it like a factory style process where a lot of medicine is factory style, it can be a lucrative model. But if you're doing it right, you want to have an understanding of how the body works and what the platelets do in the body to decide what kind of treatment you need. It's not as simple as just taking like steroids out of an injection and putting PRP into it and hoping for the best. It works best when it's put into the context of the biomechanical model of the body. So we've talked about like joints, how they move. They roll, and their stability is dependent on the ligaments that are holding that joint together. As we age, just as how our face develops wrinkles, our body develops wrinkles, and so these ligaments can become loose and slide rather than roll. In fact, like if we pretend like this is the two sides of a knee, and these are the ligaments that hold it together, you can see that when this joint is moving, it's just rolling. But if it lost the ligament of support, so now there's slack in that ligament, when you go to move that joint, it has to slide first to take up all that slack, and then it can roll. Well, the two damage points in that is that in that sliding process, you're no longer rolling. Now you've got friction, which is going to erode the cartilage, but it's also going to reduce the surface area that does roll, and so you get more erosion and damage in the area that does make contact. On top of the fact that just sliding will mean that those ligaments are getting stretched and taut, and every time you do that, that's going to cause pain. A lot of arthritic changes are really painful, not because of the erosion, but because of the ligaments being tugged and pulled.
So that's how a lot of these old athletes can have it. So the old injury they had in high school for their knee injury,
right,
it seems like it's okay, but the ligament seems to be overstretched, and as we got older, the ligaments get looser and they can't handle that injury as well.
Right. You can scar the ligament, which creates some initial stability, but then as that ligament gets pulled on and stretched, all those fibrous tissues that are in the scar, they're not as strong as tendon or ligaments. They're going to start breaking down as we age, and a problem that occurred like in your teens may not show up until you're in your 30s or 40s. On top of that, those injuries are going to they're going to create instability in the knee, and so that can domino and snowball out of control. So a small problem will wiggle, and then become a bigger and bigger problem until then it becomes symptomatic.
So how does the PRP stop some of that extra wiggling from happening?
Yeah, that's a great question because a lot of places they're using PRP. Oh, you've got knee arthritis. Let's just squirt some PRP into it and see if that helps. And it will help. It will. But it's not a sustainable effect, because what needs to happen is you need to get a better assessment of what are the mechanics of that joint, why is it wiggling, and use the PRP at the ligaments that are most lax or lost their stability. The young athlete who injures their knee and then continues to play sports, a lot of times they're just making up the difference with strong muscles. But as we age, you're getting laxity in those ligaments and you're getting weakening of those muscles. So their stamina for compensating for that ligament laxity breaks down, and they can develop tendon issues as well as ligament issues. So understanding all those dynamics will help you understand what kind of PRP do we need to process, because you can isolate for different cell lines within blood, but also where do you want to apply it. We don't want to just do a carpet bomb and hope for the best. We want to target our specific cell lines to the specific parts of the body that need it the most.
So certain types of PRP for a ligament, but a different types of PRP for like a meniscus, and a different type of PRP for a tendon.
Different for cartilage, different for bone marrow. And the pain that you feel in a broken down joint can be from many different tissue types, and determining what that tissue of origin, where the pain is originating, is really critical in getting a good outcome from a regenerative therapy like PRP, because it's going to have different formulations for each of those different tissue types. And in fact, that's still an area of research. We're still learning more and more every year about which tissue types respond better to what formulation of PRP.
Well, I guess that's why the mapping of where the pain is coming from before the intervention is the most important thing, really.
It really is. People get frustrated because they've been dealing with a pain problem for such a long time. They just want an instant relief. But the unfortunate reality is that it took years for things to develop. It's not going to take that long for things to get better, but it can take a little bit of time, because getting it right in the front, up front, is going to be really, really key in getting the best outcome on the back end. So it might be slow on the uptake, but once we get to the right answer, to the answers, then the recovery is much faster and much more sustained.
I like the thought of that. I know as an athlete myself, I like to still lift weights, like to run around with my kids, like to coach wrestling, that if I started to lose my ability to do those things because of an injury, I wouldn't even be myself anymore. It's such a huge deal. And so it sounds like this is going to be something that our athletes can be able to do, is right when they're starting to feel like they're losing that ability to be who they are, this could give them some of that back.
Yeah, and I am such a supporter of athletics, because it's really the lubrication of life. It's the way that our bodies repair and identify damage that needs repair. So if athletics is a big part of your life, it's so key for us to figure out how we can maintain that for as long as possible. A lot of people quit the athletics that they love doing because it hurts to do those things. And to me, that's a travesty, because if you've been doing it for a long period of time, that becomes part of who you are. It becomes part of your identity. The last thing in the world that I want happening is for people to start cannibalizing parts of who they are, just cutting off parts of who they are to accommodate a pain problem. That is when we really need to get involved. Our identities are sacred. Who we are, just by the nature of who we are, is value. We all have this impression that what we do for each other and what we do for the world is what determines our value. But really, it's who we are as individuals. And if your sense of self is being changed by the presence of a painful condition, there's nothing in the world that's more important to me than getting you back to who you are as an individual.
That's really important to think about. I just think about for myself that since I like to lift weights as the exercise that I do, if I had some sort of injury that stopped me from doing that, I just wouldn't do as much exercise, and I wouldn't be healthy.
And it snowballs. Like, if you stop doing the things that you loved doing, well, how is that going to have an impact on your mood? It's going to start to make you feel less of the person that you once were, which inevitably will give you some sense of sadness, depression, a loss of morale. And that makes you less motivated to push harder, to get back into that athletic activity, to do things that you once loved doing, which will make you even more depressed, and it just kind of spirals out of control like that. A lot of patients that we see have gone through what I call the hope and despair cycle, where they've sought treatment, it didn't work, and they come to the conclusion that it's not the healthcare system, it's me, I'm broken beyond repair. People can only go through that cycle a few times before the energy of activation to have hope again becomes so cumbersome they just don't want to do that anymore. That's too late. We need to get to people before we get to that stage. We need to move things upstream so that we can intervene on people and get them back to the athletics that they love doing as early as possible.
I'm glad that we're talking about this. I think that too many people think that when it comes to an orthopedic injury that the only option is surgery for anything. And when I consider about how long that takes for you to recover from that, and I just saw something in a journal. If you had an ACL repair, if you went back to your sport before 9 months had passed, you were 7 times more likely to actually re-tear that ACL again.
Yeah.
Well, that's all that time from the recovery, and then just sitting around waiting to do something again. And that's even on a partial ACL. Oh my gosh.
Yeah, I'll tell you, I had my best friend from college, and she won't mind me using her name. She's a neurologist up in New York. She had an ACL tear playing ultimate frisbee. She was huge into ultimate frisbee. I mean, this is a girl that tore up every limb in her body to play ultimate frisbee. And she called me one day and said, I went skiing and I tore my ACL. We looked at it under the MRI that she brought, and it was a pretty significant tear. I mean, there was still, when she got the MRI, it was in the acute phase. There was still blood in the joint and just a really rough-looking ACL. She asked me, is there anything we can do? And I said, yes, there are stem cell injections that can help with that. So she came down, we did a stem cell injection to her ACL, and about 3-4 months later, she got a repeat MRI, and the radiologist called her up and said, there's no tear here. I mean, there must have been a misdiagnosis. He even went back and looked at the old MRI, and he said, there was blood in there. It was just a bad read. There's no way there could have been a tear there. This stuff works. It really works. It's just knowing where to apply it, knowing what to apply, what cell lines are going to be important for recovery of tissue, and doing a good job about it. But I would say that there's a lot of surgeries that take place for which this technology works really well as an alternative, if not as a supplement. A lot of patients come in and say, well, should I have the surgery or should I do the regenerative therapy? And hands down, you don't burn any bridges by doing a regenerative therapy. If anything, when people are trying to do surgery, they're trying to reconnect tissue that no longer has a bridge between them. And if you're sewing through a frayed, silky fabric, there's no suture that's going to hold within that fabric. But now we do a regenerative therapy, and even if the damage is too great for that regenerative therapy to work, you can at least build up the tissue so that now, instead of it being a thin, frayed, silky fabric, you've got strong hemp denim that's going to hold the sutures that you put into it. So the regenerative therapies like PRP and stem cell do an excellent job where even surgeons can't get to. But even if it's something that necessitates surgery, a lot of times we can build up the tissue much better before you have that surgery to give it the best outcome possible.
Well, that's really interesting to hear. And I've thought about people referring to rotator cuff tears kind of like that too, where if it's so torn, it's almost like trying to sew together pieces of wet toilet paper.
Yeah.
It doesn't seem to do pretty well. And I bet that surgeon's going to appreciate it if it's, instead of wet toilet paper, you got some nice steak for it to at least cut it together with. Well, that's pretty interesting. Wow.
We got a comment from Dr. Faulkner. He's a chiropractor here in central Kentucky, and he came to me with shoulder issues. He was told he had to have surgery for a rotator cuff tear, and we ended up doing a pain mapping and better isolating where the origin of that damage was, and did a PRP. And this guy's, I call him a beast because he's a huge muscular guy. Yeah. And he's gone back to lifting, and he's doing great. So I appreciate Dr. Faulkner for chiming in and sharing your own personal story. I appreciate that.
Mm-hmm. So what do you think is a good spectrum of things that people should consider for PRP treatment if they have an injury?
Say again?
Like body parts that they've got, orthopedic injuries, what they should be considering for this.
Frankly, anywhere in the body, I say that this is the primary care for things that hurt. If it hurts, give us an opportunity to evaluate it and see if it's something that we can address. If not, we're the best suited to figure out what the problem is, what the rehab course is, and what the timing for surgery, if it's inevitable, should be. But generally, anything like rotator cuff tears, any tendon issues like epicondylitis,
like tennis elbow?
Okay. Golfer's elbow, any arthritic issue, because like I said, arthritis is typically the precursor to an arthritic joint is a lax joint, or a joint that has lost its stability, so ligament problems within it. Tendon issues in the knee, for instance, patellar tendonitis.
Oh yeah, that's sticky.
Medial collateral issues, or medial meniscal, lateral meniscal issues. Medial meniscal issues are very, very common, and oftentimes it's because, again, the joint has lost its rotational stability, so you get a lot more stress, particularly because the hips are wider than your feet. You get a lot more stability issues on the inner part of the knee, so medial meniscus, collateral ligaments, ACL, tears, Achilles tendinopathy, decurvain synovitis.
What's that? That's the
thumbs.
Oh,
yeah.
the thumb pain that's right there.
Yeah,
I gotcha.
exactly. You've got two tendons that run through your thumb, and they can become irritated and inflamed, and over time, it can evolve into including the joint and becoming an arthritic joint as well.
Oh, kind of like my grandma's problem right about there.
Yep.
Okay, I gotcha.
Exactly.
CMCOA. All right, so if somebody has a PRP injection, how long do you think it's going to take for them to feel like they've gotten some benefit and, of course, fully recover?
A lot of people ask that question. To me, it's like getting a really bad haircut. How long is it going to take? I mean, you and I probably, we don't have these problems as much anymore, but think about how long it takes for your hair to grow out. We're working on rebuilding healthy tissue, so it's going to take about 4 to 6 weeks to even really see any outcomes. Some people will feel benefits earlier than that, and that's typically because there is, there's good inflammation and there's bad inflammation, and PRP preferentially promotes the good types of inflammation and limits the bad types of inflammation. So there's an anti-inflammatory effect from regenerative products that people can sometimes feel pretty instantaneously. But generally, I tell patients, we're not anticipating any changes for at least 4 to 6 weeks, and sometimes up to 2 to 3 months. Beyond that, the injection will continue to evolve and work, but a big bulk of the effect is going to be seen within that 2 to 3 month period.
That's good to know. Okay, so I want to make sure I recap this pretty well. When it comes down to this is PRP, stands for platelet-rich plasma, and we can be using this for a whole lot of conditions, tendinopathies like your tennis elbow. You can use it on ligaments. You can use it on all sorts of muscle tears. You can even use it on meniscuses or even inside a disc, stuff like that too. And an ACL, which was crazy to hear that you can have that without surgery, which is fantastic. Yeah. But it also sounds like if your practitioner is not doing appropriate mapping of the tissue and not looking at the biomechanics, you might just be wasting your money and then ending up getting surgery anyway.
It hurts me when people say, well, I had PRP a year ago and it's time for me to do it again. And I'm like, no, it's not. If it's done right the first time, it's not something that needs to be revisited unless you've got a degenerative process that just keeps on evolving. But a lot of times, it's a one and done. We do this and people get better and they don't come back to see us. I keep joking that I want to put ourselves out of business by getting enough people well where, we don't have business. That'd be great. But the reality is we're all in a process of aging and breaking down, and that's never going to happen. I just don't want to see this ballooning practice where every year we have more and more patients because we don't have any patients leaving our system. I want to get people well enough where they don't come back and see us.
That sounds pretty fantastic. All right. We
Yeah.
can do that. So, I like that. Let's finish this up.
Yeah, well, I appreciate everybody chiming in today, and if you have had any regenerative therapies from us, by all means, leave us comments, encourage people about what your experience has been. This is a new technology, this is a new approach, and a lot of people are unfamiliar with it. So it's going to take time for people to understand it, and we particularly want to push the bad players out of this market because this is a great technology when used well, and it can be very discouraging if it's not used well. So I encourage you to share your stories with the community. Thank you everyone for watching. This was the 50 Shades of Pain show. Each patient is different and there are numerous factors that can contribute to your pain. In the same way, we recognize each patient as individuals and create treatment plans designed specifically for your health. Our WellWord team looks forward to partnering with you. I'm Dr. Donish.
I'm Dr. Escaloni.
And we encourage you to start your healing journey at wellwordmed.com. Thank you.
Thank you.